Hey guys, it's Dr. Green here. We're talking about Hashimoto's, the link to autoimmunity, and pregnancy. So many of the patients that I see for thyroid dysfunction come in and they said their symptoms started during or after pregnancy. You know what? Some women do find that they end their pregnancy with not only a new baby, but a new hypothyroid condition as well. It's because normal immune shifts during pregnancy can trigger an autoimmune disease like Hashimoto's hypothyroidism. Depends sometimes on genetics and other predisposing factors. The immune system can be looked at as having two primary roles. One that reacts immediately to an invader, like pus surrounding a splinter, and one that reacts later to produce antibodies, such as to build immunity to a virus. The part of the immune system that reacts immediately is called Th1 or T helper 1, and the delayed response is Th2. When one of these arms of the immune system becomes overly dominant, it can trigger an autoimmune disease such as Hashimoto's disease. Researchers are increasingly finding factors that lead to immune imbalances and trigger autoimmune diseases. They can include not only a genetic predisposition, but also food sensitivities like gluten or dairy, environmental chemicals like those found in plastics, leaky gut, viral or bacterial infections, brain injury or degeneration. And when a woman's immune system is already linked at the tipping point, pregnancy can push it over that line. Pregnancy in the postpartum period naturally polarizes the immune system. In the third trimester, the Th2 immune response is dominant. Postpartum, the Th1 immune reaction becomes stronger. If a genetically predisposed woman goes into pregnancy with an existing immune imbalance, these natural immune shifts could trigger Hashimoto's or other autoimmune diseases. For 90% of Americans with hypothyroidism, Hashimoto's, an autoimmune disease in which the immune system attacks and destroys the thyroid gland, is the cause. In 1997, the Journal of Endocrine and Metabolic Disorders published this science. This is not a new information. Every one of your doctors knows that you have a 9 in 10 chance of having Hashimoto's when you have hypothyroidism. But yet they don't test for it, they don't treat it, they ignore it. There's nothing they're going to do for you. Here's the thing, pregnancy can also trigger hypothyroid symptoms that are not autoimmune. A common cause of low thyroid function is chronic stress. Common stressors include leaky gut and gut infections, food intolerances, blood sugar imbalances like hypoglycemia, low blood sugar, or insulin resistance or prediabetes. How about hormonal imbalances? These stressors can depress the pituitary gland in the brain. The pituitary gland controls hormone function in the body. When this happens, the pituitary fails to signal the thyroid to produce enough thyroid hormone. For many women, this manifests not only as low thyroid function, but also postpartum depression. Because so many women enter pregnancy dealing with immune imbalances and chronic stress, the increased demands of pregnancy overwhelm the body, which can lead to hypothyroidism. Ideally, a woman will address health and immune imbalances before conceiving to reduce her risk of hypothyroidism. A preconception health overhaul may also lower the risk of her infant developing eczema, asthma, food allergies, and even autism, which has been found to be caused by brain autoimmunity in many cases. When the mother's immune system is healthy and balanced, there's a stronger possibility her babies will be too. Ask my office how to determine if your autoimmunity was related to your pregnancy and how we can help you. Call 704-987-3993 to schedule your appointment with me, Dr. Green, today.